Thank you, Mr. Chairman, for calling this hearing on the National Breast and Cervical Cancer Early Detection Program administered by the Center for Disease Control and Prevention, the CDC. Today's discussion gives the committee an important opportunity to emphasize the priceless value of screening and early detection in the fight against breast and cervical cancer. We need to know what works, what we can do to make it work better, to maximize the reach and effectiveness of federal funding for screening low-income, underinsured, and uninsured women. In the United States, 1 in 8 women will be diagnosed at some point in their life with breast cancer. Yet due to improvements in screening and treatments, breast cancer survival rates have risen steadily. Likewise, over the last 3 decades, the cervical cancer incidence and mortality rate have declined by 50%. Cervical cancer is actually preventable and curable if it's detected early through proper screening. These are important advances, but not all American women are sharing equally in these critical health gains. According to the CDC, essential screening tools, mammograms and Pap tests, are underused by women who have less than a high school education, are older, live below the poverty level, or are members of certain racial or ethnic minority groups. Failure to get appropriate screening has, in part, resulted in these populations of women being diagnosed later and having higher mortality rates than the national average. Timely screening can prevent needless deaths. Recognizing the value and importance of providing preventive services to low-income women, in 1990, the Congress created the National Breast and Cervical Cancer Early Detection Program. Since 1991, the program has served almost 3 million women and diagnosed 26,000 breast cancers, 88,000 precursors to cervical lesions, and 1,700 cervical cancer. The 1990s saw the program grow into maturity. Every $3 in federal funding must be matched from state or local sources, and at least 60% of federal funds must be spent on direct clinical services. Today, there are more than 65 state and tribal grantees who are given substantial flexibility to manage individual programs. If a woman is diagnosed with cancer through these screening measures, a program case manager will assist her in getting the appropriate treatment. But because the program serves uninsured and underinsured women, finding affordable treatment can pose a significant challenge. To address the gap between diagnosis and treatment, Congress in 2000 allowed states to amend their Medicaid plans to cover treatment needs identified by this early detection program. All 50 states have amended their plans to allow these women to have access through Medicaid. Despite clear success in reaching a vulnerable population, the percentage of eligible women reached through the program remains low nationwide and varies significantly from state to state. The CDC and the U.S. Census Bureau found in 2002-2003 that only 13%